Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through January 20th, 2022. This week, I'm going to continue with the update on the current surge, what's going on globally, domestically with Omicron. Then I'm going to talk about what we should do with home test kits and N95 masks that the government is making available to us. So to start with the surge, we're continuing to see the same pattern that we've seen before, where really a tripling or more of reported cases around the world, but not quite the same increase in deaths, fortunately. This isn't as great news as it might appear because, as you can see, the number of deaths today is pretty much where it has been, except for the three previous spikes. There have been 5.5 million deaths worldwide, and we're running about 7,200 deaths per day. We're seeing the same pattern in the United States, this phenomenal increase in the number of reported cases, which is probably an underestimate because of the number of people that are testing at home or on their own. And again, we're not seeing the same level of spike in the number of deaths, but we are seeing an increase over the last 6 or 8 weeks. And again, this increase puts us considerably above where we have been for much of the pandemic. 880,000 deaths in the US and almost a little over 1,800 deaths every day. So still something to watch very closely. Of concern, as we've said before, is hospital admissions. They tend to predate deaths by a few weeks. And what you can see is that we are at, for the highest risk group, those over 70, we are at the highest level we've been at any time. So again, we're clearly not past the worst of this thing. A month ago, this is where the cases were, and you can watch every week. It's just exploding around the country, now pretty much everywhere in the US. In Tennessee, we are seeing a unprecedented spike in cases, but not proportionately as much higher as the rest of the country is seeing. And we're not seeing a clear pattern in deaths, though the numbers we're running right now are really the second highest peak that we've had. We've had over 21,000 deaths to date in Tennessee, and we're running about 50 to 70 deaths a day. And again, hospitalizations are up, especially in the high-risk groups. So again, we're clearly not past the prime, though as you can see in both the US and Tennessee, the number of hospitalizations may be coming back down, which would be a good sign. In terms of our region, Ballot Health is reporting 349 inpatients. 86% of them are not fully vaccinated. But again, the high risk, those in the intensive care unit and those that are intubated overwhelmingly are not vaccinated. There's been some discussion about whether or not we are seeing what we might call incidental COVID. In other words, someone who's admitted to the hospital for some other reason and tests positive for COVID. And I think we are seeing a little bit of that, but not as much as folks might imagine. I went back and recreated the hospitalization numbers from the last 5 months from August to January. This is in the Ballot Health system. And then I superimpose on that the number of patients in the ICU and the number of patients that are intubated. And what you can see is there does seem to be some widening of the gap between the hospitalizations and those that are intubated or in the ICU, which could suggest one of a couple of things. One is that Omicron is less serious. In other words, for the chance of being hospitalized is greater than your chance of being in the ICU. Some of it could be the result of vaccinations, which we know protect people from ICU and intubation. But some of it could also be what we would call ancillary or accidental discovery of COVID-19. And so what I did was I looked at the percent of everyone in the hospital that was in the ICU, and you can see it was running pretty consistently between 24 and 28%. So about 1/4 of all the hospitalizations in the Ballot system for the last 5 months have been in the ICU. And then this week it has dropped down. Now, that may just be an anomaly of reporting, or it may be, as I say, that COVID is less serious or more people are vaccinated, or that we're finding some ancillary COVID. Having said that, we're still at the highest number of ICU and intubated patients that we've had in the past 3 months. So again, yes, we may be seeing this variance, maybe seeing more incidental COVID, but we're still nowhere close to being out of the woods. Just think about this, 70 patients in the ICU and 51 who are intubated. This is still a very serious pandemic in our region, in our state, and around the country. Now, to address this, the government is proposing to send us home test kits and by the end of the month to be providing N95 masks. So how do we deal with this? Well, first of all, how to get your test kit. There's a website, www.covidtests.gov. You can go there and log in and get them sent to you. When do you want to use the home test kit? Well, there's 3 times. The first is if you have symptoms. Now, the reason I wrote caveat there is to remind me to say that if you have symptoms that you think are consistent with COVID, you shouldn't be going to work or school anyway. All right, that's one of the recommendations is we don't go to work or school if we have symptoms of what could be a communicable respiratory disease. Second time to use it is if you've been quarantining yourself at home, you were exposed, you want to test to be sure you're not infected. That's a good time, what we call testing out. And then you may also wish to do home test kits if you're going to be around folks at high risk. You're going to have a small gathering for your grandparents who are getting to be 100 or something like that. So that's a good time to use it. How do you interpret the test results? Generally, if you get a positive test, you have to assume that you're infected. You're probably infected. There are certainly false positives. But generally speaking, if you take a home test kit and an antigen test, a test that's looking for viral particles, and it says you've got them, you have to assume that you have them. On the other hand, if the test comes back negative, you are probably negative, but you may not be, because it may be too early. And so you may need to retest. Some of you will remember this chart from a few months ago. And basically, it tells you that at time 0, when you're exposed to SARS-CoV-2, the virus that causes COVID-19, there's initially a slow increase in the amount of virus. Then it goes up very quickly, and then hopefully you get better and it goes down to 0. That's great. But imagine there's an antigen test, a test that looks for viral particles. There'll be a level below which the test will be negative and above which the test will be positive. Well, way out there, as it's coming down, if it says it's negative and you're about to be free of virus anyway, you're not particularly infectious. But if you test yourself here early on, you've just been exposed to somebody and you test yourself and it comes back negative, you may in fact be infectious and about to get a spike in the amount of virus. And that's why we say that if you're negative, you probably need to retest before you act on that. If you are positive, please report your test results to the health department or your healthcare provider or somebody. The thing I'm worried about, we're going to have a lot of people testing themselves at home. We won't have any idea how widespread the infection is unless they get reported. Conversely, if you're negative, but you're sick, don't assume that you're completely well. So contact your healthcare provider if you have symptoms. In terms of masks, we're about to get access to masks. And what I understand is they won't be mailed to our home, but they will be available through pharmacies and community health centers. The reason this becomes important is there's an increasing number of reports now that if you wear an appropriate face covering, you could be protecting yourself. Remember, we used to say, I wear a mask to protect you in case I'm infected. You wear a mask to protect me in case you're infected. There's now data coming out to suggest that, in fact, a mask can protect the wearer as well. That's very important. There was a report from the NIH, which is linked to below there. Masks can help protect people wearing them. Studies have found that an appropriate mask blocks aerosol from entering the airway very effectively. And as you know, CDC updated their guidance and say while all masks and respirators provide some level of protection, properly fitted respirators provide the highest level of protection. So the government's going to send out N95 masks. And this raises the question when people have looked at their mask and said, well, mine says KN95. Well, there are a variety of masks. This is a report put out by 3M, I believe, that looked at the various types of masks, these higher end masks, and they basically say it's reasonable to consider the KN95 and these other masks as equivalent to the N95. So the masks that I wear is a KN95. I get it snug around even though I have a beard. And then for those of you who have your favorite mask that you've been wearing, you may want to still wear it. That's great. Just put it over the top like that. So the surge is still happening, unfortunately. We may be seeing a cresting in hospitalizations, which would be nice, but right now we're seeing an unprecedented number of cases and increasing number of deaths in the US and in Tennessee. And what we should do with home test kits is use them wisely and carefully and wear masks whenever we're around other people. There's a great deal more information about COVID-19 on the College of Public Health website. If you are sharing this video with anyone or you know anyone who would like to see it, please feel free to share it. Obviously, the more information we can get out, the better. I'd like to thank Dara Young for editing and producing and posting this video and all of the other 160 or so that we've done over the past couple of years. Finally, as always, if you have any thoughts, questions, comments about the pandemic, please let me know. I answer a couple of questions a week offline, and I add some information into the updates every week. So I look forward to hearing from you. Until next week, please be well. Thank you very much.